Which of the following risk factors is most likely associated with this patient's condition? HPV, smoking, lichen sclerosis, vulvar, intraepithelial neoplasia, or chronic vulvar inflammation. This is a 68-year-old woman presenting to her gynecologist with a 3-month history of vulvar pruritus and a non-healing ulcer on her labia majora. She has a history of well-controlled type 2 diabetes mellitus and is a non-smoker. On exam, there's a 2 centimeter ulcerated lesion on her left labia majora, and a biopsy of the lesions performed, and the pathology report confirms vulvar squamous cell carcinoma. Which of the following risk factors is most likely associated with the condition? Um, so let me think out loud. Okay, the my gut says it's lichen sclerosis. I know it's super, super rare, but it can potentially lead to it. The other like random thought I had was the vulvar intraepithelial neoplasia, but that's so difficult to distinguish between HPV and that answer that it's most likely that neither of them are right. So I'm gonna go with the lichen sclerosis.
Final answer.
Yeah.
Good. Good. So definitely for sure 68 well controlled, right? And then a non-healing ulcer, and then you get SCC. But just remember, lichen sclerosis, you can get chronic inflammation of the skin, right? As you said, and this increases your chance of vulvar squamous cell carcinoma. HPV, right? Is a risk factor for vulvar intraepithelial neoplasm that can, but more commonly with younger patients. And like you said, it's kind of, this and HPV infection go, they're part of the same kind of cycle, or I guess timeline, right? So they can't both be the answer, right? So that's good test taking strategy there. Um, Smoking, right, can, but patient's a non-smoker. And then chronic vulvar inflammation can, however, lichen sclerosis is more specific risk factor associated with the patient's age and presentation. So it's just a better answer. Okay.
Perfect.